This morning, actor James Pickens Jr. revealing that as his character, Dr. Richard Webber, revealed his cancer diagnosis on screen in the mid-season finale of Grey's Anatomy.
He gave me my biopsy results. I have cancer.
Off-screen, James was going through his own cancer journey, announcing he was diagnosed with a rare form of prostate cancer earlier this year.
I've been getting prostate exams since I was 41. I'm 73 now. And it was just part of my regular annual physical. And I just made sure I was on top of it. My family history is such that I had to keep an eye on it. My father had it, I think a couple of his brothers. I have some first cousins who had it.
Pickens, who's been playing Dr. Webber on the show for more than 20 years, underwent a prostatectomy to remove the tumor. These days, James says he's doing well.
I had my last PSA blood test results in September, and they came back as what they call undetectable. So at this point, I'm cancer-free.
James says he hopes his message reaches others, particularly Black men.
It's very prevalent in our community, and a lot of it goes undetected. So I wanted to do my little part to get the word out to say, go get screened.
Prostate cancer is the most common cancer after skin cancer for men, and the second leading cause of cancer deaths. Rates of prostate cancer are higher among Black men, and they are more than twice as likely to die from the disease compared to white men. James says prior to the diagnosis, he experienced no symptoms.
Early stage prostate cancer, the one typically detected with a blood test, really doesn't produce any symptoms.
Experts say prostate cancer screening is individualized, but can help find the diagnosis early.
Maybe we can stop a lot of unnecessary folks leaving here before they have to.
Well, James tells us that after his diagnosis, he actually brought the idea to Grey's Anatomy and asked that if his character, Dr. Webber, could mirror his own cancer journey, saying he wanted to use his platform to start a discussion about men and prostate cancer. And guys, he tells us that if all of this can save just one life, well, then it would have been worth it.
Good for him to step up like that. Maggie, thank you so much. I know we're going to talk more about this, George.
We are. We have Dr. Tanarula is back. Let's talk about screening. First, who should be getting tested? What does that involve?
Yeah, well, George, 1 in 8 men will be diagnosed with prostate cancer, about 300,000 new cases this year alone. And you heard it's the second leading cause of death for men after lung cancer. However, most men actually don't die from prostate cancer. When it's found, typically about 78% are localized disease. Now, the important thing to know is that there are risk factors. So you heard in the piece being African American, having a family history, and typically older men, older than 65. It is rare to see it under the age of 40. In terms of symptoms, you heard as well, tends to be in some cases asymptomatic. If men do have symptoms, it may be things like urinary frequency, difficulty urinating, blood in the urine, also fatigue, back pain. Those can be some other signs. Now, in terms of screening, what's interesting is the American Cancer Society has said this should be a shared decision-making between the patient and the doctor, where you discuss the benefits, the risks, and also the uncertainties around screening. That discussion should happen at age 50 for most men who have an average life expectancy over 10 years. However, if you have a family history of a first-degree relative, meaning a father or a brother who had early prostate cancer before 65, or you're African American, then that discussion should happen at age 40 to 45. How do you screen? Well, as well, the PSA, we touched on that too. That's a blood test, a very simple blood test. And that happens every 1 to 2 years up until the age of 70 to 75. Now, it's important to note that the PSA can be elevated in cases that are not significant for cancer. There are other things that can cause that, and ultimately diagnosis is made with tissue, with a biopsy specimen.
And if you get it early, it can be treated.
It can, and so there are different ways to treat it. So there's observation, there's surgery, there's radiation, there's hormone therapy, and all of that really depends on the age of the patient, their health goals, their underlying health conditions or status, and essentially, the overall risk group and stage of the cancer.
Dr. Narula?
95%, 97% survival at 5 years.
That is huge.
Yes.
Thanks very much.